Dr. Smail Khan, now let's talk about obesity. If it affects more than 1 billion people the world over, it in some countries more than others, like in India and US, nearly three quarters are overweight or obese. In the UK, nearly two-thirds. In China, half the population is overweight or obese. Obesity is a global epidemic. It has been one for 30 years now, but here's the kicker: we don't know what obesity is. We don't understand it. You may say it is a disease, obviously, but it's not that simple. Some countries call it a disease, like the US, Canada, Germany, and Italy. Some call it a public health issue, like India, China, and Japan, and others, like Saudi Arabia and Denmark, call it a risk factor. Obesity is a polarizing topic for doctors, insurance, government, patients. Few are on the same page, but this is a reality. In the next 10 years, half of the world will overweight or obese, and this will cost the global economy how much? About $3 trillion every year. Meanwhile, the demand for weight loss drugs will continue to soar. In the next 5 years, they will have a 200 billion market. This is a crisis in the making. So the obesity dispute is coming to a head, and experts are rushing to find answers. Now they have a proposal. New global report is out. It is supported by more than 50 medical experts, and they propose what they call a radical overhaul, a complete overhaul of how we define obesity and how we diagnose it. Before we talk more about this, before we understand why we need checkup, let's understand the problem. So according to the present definition of what is obesity, it is seen as an excess of body fat. We gauge who has too much fat by using the BMI. The BMI mass, the body mass index, the BMI. Estimate body fat based on person's height and weight. If your height is your height divided by the square of your, it is your weight, rather divided by the square of your height. So if you have BMI of 30, in many countries you are obese, and there is a major problem with this concept. Some people don't have a BMI of 30, but they have excess body fat, and they go undiagnosed because the BMI scale does not think that they are obese. Similarly, same patient have a high BMI, so they are diagnosed with obesity despite having normal organ function and healthy body. This is a issue with the BMI. For decades, it has been used to diagnose obesity, but the same BMI is at the heart of this new debate. This is what experts say. You see, BMI was never meant to diagnose patient. It only measure the ratio of your height to your weight. It says nothing about your obesity symptom, your fat accumulation, your fat distribution, your muscle weight, your blood sugar level. It cannot even determine whether you are healthy or risk. No two human bodies are the same, and the BMI is no way to measure obesity. So new experts went to rethink this standard. They went to go beyond the weight. They went to look at how weight is distributed throughout the body, or how excess weight leads to a medical complication from breathlessness. while walking to knee pain and organ failure. They went to redefine obesity and acknowledge its reality because they obey why it is understood. Today, obesity makes patient out of people who are not ill and ignore those who need urgent care. We have declared it a disease without really understanding what the disease is, and this has left million vulnerable. It has left people open to accusations over treatment, under treatment, and mistreatment. And so 30 years after declaring obesity and epidemic, medicine is finally doing a better job at figuring out what is as they say, better late than